Facilitator of today's meeting, and I'd like to welcome everyone. So with no further ado, I thought I'd just go ahead and turn it over to the group and do some brief introductions. I know we have some new members to the group, so we're excited to introduce those to the group and just give a great welcome to some of our presenters today. So I'm going to go ahead and kind of go around the room, so to speak, as I see them on my screen. So I'm going to start with Chris Blue from City of Tucson. So good morning, Chris.
Hi, good morning, Janine. Good morning, everyone.
And Chris, did you just briefly want to share what your role is?
Oh, sure. Yeah, I'm a transit services coordinator for the City of Tucson in the Transit Services Division, and we oversee our contractor who manages the city's transit system consisting of Sunlink, Suntran, and Sunvan. Yeah, and happy to be here.
Thank you, Chris. I'm going to go ahead and allow Louise to introduce herself. So Louise Navarre, if you'd like to introduce yourself.
Hi, everyone. Louise Navarre. Nice to meet you all. I am with Suntran. I'm the Community Outreach Manager here, and I work in the marketing department, and we do all our modes, so Sunvan, Sunlink, Sun Shuttle, Sun On Demand. So, and I'll be actually sharing some information with you guys soon. So thank you for having me.
Thank you, Luz. And then go ahead and turn it over to Meg Knight.
Good morning, everyone. My name is Meg Knight. I am the grant writer at the JCC here in Tucson, and we provide day programming for young adults with disabilities. And my colleague is Renee Stevens. Maybe I should pass it off to her.
That'd be great. Go ahead, Renee. Good morning. Thank you, Meg.
Good morning. I'm Renee Stevens. I'm the CFO here at the Tucson JCC.
Great. Thank you. Thank you, Renee. I'm going to go ahead and turn it over to Carmen Johnson.
Hi, everybody. I am the Associate Director with Catholic Community Services, Deaf and Residential Services. We provide support to adults with developmental disabilities in group home settings and independent apartments, as well as day program supports. And I will turn it over to Jessica. I saw her on the phone just a little bit earlier. She is my colleague with the Catholic Community Services.
Great. Thank you, Carmen. Jessica, good morning.
It looks like she just dropped off. She may be trying to rejoin.
Okay, we'll give Jessica a few minutes to rejoin, and then when we see her pop up, we'll give her that opportunity to introduce herself to the group. So I'm going to go ahead and continue on and allow one of our newer members to introduce herself. So Kim Herzing, I hope I'm pronouncing that name correctly. You want to go ahead and introduce yourself? I'm not sure if Kim can hear me this morning or not. I'm going to go ahead and come back to Kim in just a moment and turn it over to Nick Trees from La Frontera.
Hi, I'm Nick Trees with La Frontera, Arizona, La Paloma Family Services, and Southeastern Arizona Behavioral Health Services. I do the facilities and transportation services for all three entities.
Great, thanks. Good morning, Nick. Great to have you with us this morning. They're going to go ahead and see if Kim can hear us in just a moment, but right now I'm just going to go ahead and give her just a few more minutes and see if Steve Nath would like to go ahead and introduce himself.
Hi, I'm Steve Nath with Hope Inc. I'm the operations manager, and I work alongside Irma. Well, pass off to him in just a second, overseeing the fleet that we have across our 7 sites in Southern Arizona. And actually, Irma may not have her webcam set up, but maybe she does.
Okay, thank you, Steve.
Hello.
Hi, Irma. Can you hear us? Go ahead and introduce yourself. Thank you, Steve.
Hi. I have something connected here. I'm hoping you can hear me. Can you hear me? Hello.
Hi, Irma. Yes,
Hello.
we can hear you. Go ahead.
Oh, good. Hi. I'm Irma Llamas, and I'm the fleet manager for Hope Incorporated for behavioral health.
Hi, Irma. Thank you. Good morning. I'm going to go ahead and let Jolene Summerson introduce. Good morning, Jolene.
Good morning. My name is Jolene Summerson. I'm the operations manager for Savvy Services for the Blind in Tucson. We are a teaching facility for the visually impaired.
Thank you, Jolene. And then I did connect with Kim Herzing from Marana Healthcare. So good morning to Kim. It appears her mic is not working at the moment. So we're going to just extend some grace around some technology challenges as we navigate this virtual meeting. So good morning to Kim nonetheless. So welcome. We're going to go ahead and allow Mike Alexander to introduce himself this morning.
Morning, Mike Alexander, transit crew leader for Oro Valley Dial-A-Ride.
Great, thank you, Mike. And then I see Donna Gillette, so I don't want to forget Donna. So good morning, Donna.
Good morning, Janine. Good morning, everyone. I work with Easter Seals Blake Foundation. I'm one of the associate directors, and myself, along with Mandy Hendricks, does most of the transportation. I've been doing transportation for, I can't even count how many years. So anyway, and we're a pretty well-rounded agency. We have services for people with disabilities, services for behavioral health. We have, a variety of services, and the majority of them are involved with ADOT transportation.
Great. Thank you so much, Donna. I appreciate you investing time today to be with us. We're going to go ahead and move forward to the first item, or the next item rather, on the agenda. Forgive me if I missed anyone. Did I miss anyone on the introductions? Is there anyone on the call that I didn't allow a time to introduce? And if I did have an oversight, I apologize. I tried to capture everyone. I think that's everyone. Okay, so we're going to go ahead and move forward with the next item on the agenda, which is the in-kind form. And as you might be aware already from previous meetings, we use the in-kind form to collect in-kind. And so we will go ahead and take record of all those that are participating in today's meeting to capture that for in-kind. The one rule that we do have to follow with that is that if your salary is paid for with federal dollars, we cannot count your hours for participating in this meeting towards in-kind match. So if there's anyone on the call today whose salary is paid for with federal dollars, please let me know of that so I can make sure we do not capture your specific hours for in-kind match. Of course, you will still get credit for attending today's meeting. So I see Chris's hands up, so thank you, Chris. I appreciate that. If there's anyone else that I should notate, you can either send me an email or use the raise hand prompt on the Zoom call here today. So I'm going to go ahead and move forward. And again, if you'd like to email me, that's fine. Steve, I see your hand up for being paid, for your salary being paid by federal dollars. So if I need to clarify anything with that with you, between you or Irma, I'll reach out to you. So thank you for that. Anyone else? Steve, did you have a question that I needed to reach out to you about? No. Okay. All right. So I'm going to go ahead and turn the conversation over to the Suntrans presentation, and we're excited to have Louise Navarre do the presentation for us this morning. So Louise, I'm going to go ahead and let you take the reins here and do your presentation, where, as you might have noticed on the agenda, Louise is going to be presenting about the on-demand service as well as their travel training project. So I see Louise has gone ahead and shared her screen with us, so hopefully everyone can see that. If you are unable to see that, please let us know so that we can do our best to accommodate in that way. So Luz, good morning. Thank you so much for investing time today to present. So I'm going to let you have the floor. Go ahead, Luz. Thank you.
All right, thank you so much, Janine. Okay, so like Janine said, we're going to go over the on-demand portion first and then move into our new travel training program. So on-demand was a new service that we started in November of 2020. It was a pilot microtransit service. I'm not sure how much of you guys are aware of this. I know we've talked about it before, but I'm kind of just going to do a quick overview of that. Let me make sure that's going. There we go. Okay, so first off, what is Sun On Demand? So Sun On Demand provides shared door-to-door rides for individuals traveling within each zone, and the riders can make the reservations on the same day or 1 to 7 days in advance. They can schedule it if they have reoccurring appointments they go to every month. And we created this in response to eliminating some of the routes in smaller neighborhoods. We were looking at getting rid of the big 40-foot buses going into these small neighborhoods. We wanted something that was more flexible, and this is definitely much more convenient for elderly and disabled riders. Getting picked up at your door and getting left at the door you need to go, it's a lot easier than having to walk, the 50, 100 feet to a bus stop. So this is a system overview of our transit in the region. And if you can see, Zone 1 is kind of on the west side. It's in Ward 1 and Ward 3 area. It's a little hard to see with this yellow in here. And then the Zone 2 is on our east side in Ward 5. It's a little yellow as well. Our Zone 1 area here, it's a lot easier for you to see. The yellow is the on-demand zone. So what this means is that the vehicle will go anywhere within the zone, door to door. So if you live in the Tucson house and you got to get over to the St. Mary Hospital, it'll pick you up there and take you straight there. We really made sure that the areas we were focusing on had some big anchors, so we got the El Rio Health Department, the St. Mary's Hospital, Boys and Girls Club. We have grocery stores and a lot of different housing communities. Something that came from the Housing Community Office was their request for us to connect to the Ronstadt Transit Center. So we started doing that just a few months ago so that people that are transferring in the transit center are able to connect to the on-demand Zone 1. So we do have a place where the on-demand vehicle will come and pick you up in this transit center. And then this is our Zone 2. Again, we were really cautious about making sure we got all the health centers and the big Tucson marketplace where you have your Costco and Walmart, a lot of other housing places in here as well. And of course the food bank is here. Then we have the diaper bank, which is right around there in that area. We did a lot of outreach events, and we're still doing outreach events. We went to a lot of the residential homes and just talk to residents within each areas about this new opportunity. And if this makes sense for your clients, or if you guys have a need for it, if you are within the zones or have clients that are in the zones, we are happy to come out and do these presentations for you. This is definitely something that was a little bit challenging for us since we launched in November of 2020. It was a completely new world of doing events. So that's why we're outside in all these pictures. But we're happy to come out and talk to any of your clients or anyone who may be able to use this service. All right, so that's all I have on demand. I'm going to kind of segue into our 5310 Mobility Management Proposed Travel Training Project. A little bit of a mouthful, but that's what we're really focusing on next. And if we have any questions on demand, after my presentation, I'm happy to answer any on-demand questions, and I'll also make sure everybody has my email in case you do have a request for us to come out and do a presentation. We're more than happy to. All right, so currently we have this START program, and we've been doing the START program for years, and START stands for Suntran Accessible Rider Training, and it's a program designed to provide bus rider training for seniors and people with disabilities. So START helps seniors and individuals with disabilities learn how to independently travel using the Suntran system. So our training covers several areas: bus travel, general bus rider information, trip planning, traveling with mobility devices. And again, this is something we've been doing for a long time. We go out to schools. In this picture here, we're at the Sahuarita High School. I believe this was at one of the active retirement homes. And a lot of people know that we do this. We have communities that do it every year that reach out to us and make sure we go out. We do things in Green Valley and Oro Valley, all around the region. We'll come out and provide these type of training. So what we want to move into is this mobility management travel training program. So our travel training program will be centered on coordinating, educating, and training individuals to use public transportation safely and independently. So our goals for that is to really coordinate across the 53 organizations. So that's you guys, all the 5310 organizations. We want to create efficient operations and improve mobility for the community. So by doing this, we'll definitely be able to raise awareness of our public transit options, build confident riders, and improve the community access, which definitely includes the health and wellness opportunities. So we really want to partner and collaborate with all of you and give the supplemental mobility that your clients, I really don't know how all of it works, so it's definitely want to hear from you all. But if there is a case where, let's say your organization only takes people to work and they only get their rides to work and they need to learn how to use transit for different things, if they have to go to a medical appointment, if they have to go to shopping, if they want to go get a burger at McDonald's, we want to make sure that we're able to teach your clients how to use different type of transit that's available for them. So that's definitely something that I hope that we can have a little bit of a conversation here soon is, what are your needs? What are your clients' needs? Where are they going? Like, what are some things that you guys aren't able to provide rides for them because maybe they're outside of your purview or they're not within your guidelines? And that's something that we really want to help with. So we're saying we're going to be a lot of doing coordinated training. So the areas that we really want to concentrate on are how to trip plan and just helping use those tools that we have, whether it's using our old ride guide books and helping them pencil in their schedules or teaching them how to do it on Google Maps, which is really helpful. And we even have like our customer service that can help give that information. They're easy, they're to work with, and they can help trip plan with them. We're really going to try to push our train the trainer courses to assist your staff in the 5310 program to help train your clients. So that's something else that we're going to be focusing on, is helping you guys learn the different opportunities that you may not know or may not know how to explain to your clients. And we are looking at just like standardizing all the training so everybody knows the same knowledge, and then providing everybody with the same materials. We want to make sure that you guys have all the materials that we have to give to your clients and be able to train them on different options that they may have. And of course, the regional benefit for this project is to educate everybody on not only our fixed route service, but all the other services that we do have to offer. Like I said, we have the Sun On Demand, it's a new service, Sun Shuttle, Sun Trans, Sun Link. We have a lot of different services that could really benefit your clients. And that's all I have today. And there's my information if anybody wants to jot it down. But I'd really love to just kind of hear from you guys and see what your initial thoughts are about this program. So if anybody has anything to share, please do.
This is Mike, Oro Valley.
Uh-huh.
With your on-demand area, do you pick up riders within the area and go outside the area, or they have to pick up and drop off within the on-demand area?
In the on-demand area, we can pick you up in the area and we can transfer you to a bus stop that goes outside of the area. But yeah, it is very just in that zone. But we will connect you to a bus stop outside of it that is going outside of the area.
Okay, I have a few if I may.
Uh-huh.
Did that take away from your fixed routes that are in that area? That your ridership drop on those fixed routes?
Yeah, so we had, let me see, in one zone in particular, we had some kind of like requests from the council member because they were doing a slow streets project. And we didn't have a lot of ridership in that area anyways, so we decided to move towards the on-demand service in that area in particular because of the Slow Streets project they wanted to do. And it just made sense because our ridership wasn't huge in that area anyways.
So do you still have the
So-
fixed routes in that area?
We still have fixed routes in that area, but we straightened up the fixed route. Let me go over to that slide. Sorry, so I can show you. And we straightened out a lot of the area. So this Route 22, this used to kind of intermingle in a lot of these like little neighborhoods. So we kind of just straightened out the route. So it still goes within it, but it doesn't go into a lot of the little neighborhoods like it used to.
Okay. And then my last question is, you're part of Sunvan or Suntran?
Yes, yeah.
So how can the on-demand that get into the 5310 grant process?
So the
Suntran
on-demand
is
isn't
large.
part of the 5310. It's not. Our travel training program is. So the on-demand isn't. It was just an opportunity to kind of show you guys a different service, but it's definitely not part of the 5310.
So the travel training is?
Correct, yes.
But again, they're part of Suntran?
It's more, I don't know what part of it is. I don't really know.
Hey, Luce,
Yeah, go ahead.
maybe I can help to answer one of the questions before, just clarification. Yes, we changed Route 22, that made a difference, but the fixed routes themselves that are left in the Zone 1 and Zone 2, they haven't seen that great a diminish because of the on-demand. It's kind of supplementing it. The way that we can help with the 5310 or are eligible for the 5310 is the travel training program follows under the mobility management aspect of 5310. And so this is part of expanding the mobility management in collaboration with PAG and the 5310 organizations. So hopefully that answers your question.
Yeah, thank you.
Hi, this is Irma. I have a question with Hope. Regarding so this is the on-demand and then we have Sunvan. So when you're calling that same number with Sunvan, you would have to make a schedule like 24 hours, I believe, or 48 hours before. But with this on-demand, you say it's pickup on the same day. Do you need to let them know that you're doing the on-demand pickup? And then what is the wait time on that?
Yeah, you would let them know that you're calling for on-demand. The wait time is up to 15 minutes is what we're quoting right now. And the reason they're able to do that is because we have designated vehicles that just stay within these zones. So it's not like they're going way out here giving a ride to somebody else. They're literally just traveling around this area for their entire shift.
Great. Okay, thank you.
You're welcome. Yeah. Well, I was really hoping to get some more feedback on our travel training. Do you guys have any questions for us, or is there these questions that we asked about, your clients' needs? You guys feel like there is some clients that are needing to get to other places that you guys aren't able to provide those rides for?
Carmen with Catholic Community Services. I think the program is really wonderful. We are able to provide transportation for most of our members' needs, but there are those members who are moving into more independent living. And I think that the program is wonderful for those guys who have the opportunity to have transportation through their residential program, but desire the independence of using this kind of transportation system.
Yes, that's exactly what we're hoping to do, Carmen. Thank you so much.
You started this in November. What's your ridership now?
Let me see. Sorry, I'm just pulling up that information real quick. I believe that we're doing, let's see, on demand. Sorry, Divya, do you know that number off the top of your head?
No, I'm sorry. I'm looking it up in the same way that you are.
Okay.
So in just the first week of August, there were approximately 118 boardings in the two areas. And there were, I'm looking for unique riders, but the service is still gaining ground. We were, doing less than one person per hour at the very beginning. And as word of mouth and people hear about the service for the on-demand service, we're moving up into over one person per hour. And our goal is to get to 3 trips per hour. And it is a limited area because both zones are less than 5 square miles, but they also connect to the fixed route. So a lot of the challenges we've had through this period is one, COVID, obviously, the health crisis is made it interesting. And then as people are starting to use it, it's definitely increasing usage. And then in July, we also had a mobile app come online, and the mobile app allows people to make a reservation without even going through a reservationist if they want to. So that seems to be increasing as well. So we're hoping that this continues to grow and kind of complement the fixed route, but it also takes care of individuals within each of the zones that maybe they would need to take, if where they're living and where they want to go shopping, if it's in the same zone. And we find a lot of people do that because of how we are very much on a grid in those areas. Somebody would have to take 2 buses to get to the grocery store or maybe to medical, and this would allow them not to have that transfer. So I'm really happy with where it is right now, but we do see it growing each month, and we're still feeling like we're still in our infancy.
Thank you. Okay, anything else?
Liz, this is Janine Sullivan. I was just wondering if maybe you could tie back to the travel training and just kind of share a little bit more fully of the different elements that you might help navigate if they were to come out to one of the 5310 organization sites and work with, some of their clients, kind of drill down on like the different aspects that you'd be able to work with them on in that particular type of training. I know you touched on how, planning of trips and using ride guides and things of that nature, but are there some other elements that you're thinking you might cover with them, just so that we can open the discussion a little bit more fully and kind of expand on what are some other needs that they might have or want to work with you on?
Yeah, so we definitely want to make sure that we're giving everybody the same information, and we want everyone to know the materials and what we have available for you all in that area. So we can really make the training specific to your area. We know everybody's kind of in different areas around the region. So we would want to make sure that we're personalizing all of our trainings for you and your clients' needs.
I'm sorry, Liz. The other thing was also making sure that everybody had the same material, regardless of which agency. And if there's opportunities where you can help us coordinate better, that's the big thing with the mobility management, is making sure that everything's coordinated. So we're standardizing our training and making sure that it is covered for all of the 5310 organizations, but also we'd like to incorporate things that you need us to have on ours, so we can help make sure that those materials across the region are consistent and kind of, again, standardized, but also it'll allow us to do more coordinated trips between agencies. So I know one of the goals of the 5310 plan is coordinated trips, and this will help everybody be on the same page and facilitate some of that coordination. Is that what you were looking for, Janine, or did you want some more specifics? Because we are still developing the program right now.
No, I think that's good. I just kind of wanted to have like a prompt if there was some things that are very specific that some of the agencies might be looking to you for support around, that they could have an opportunity to kind of share some of those, or if there was some specific touch points, if you will, that you really wanted to work with the 5310 agencies around, that you could have an opportunity to share those pieces.
It might be easier to tell you where, you know, in the vision kind of in the future where we'd like to end up is be a place where, you know, where we kind of have a clearinghouse or a place where everybody is sharing information, and that we know that all of our clients are receiving the same kind of information, so that as we're learning from each other for best practices, maybe you guys do something that we don't do and we should be doing, and vice versa. Making sure that, you know, as I'm sorry, I'm bad with names. The lady from Catholic Services mentioned, you know, as people move into more independent living, maybe there's a transition, or it's that combination of coordinated service. So that's where the questions came from, is what are your clients' needs? What are your needs? And how can we help, as we're developing this, how can we help you? And how can we make this a coordinated effort, regardless of what agency is needing the additional transportation for all of our clients?
Thank you, Davida. Thank you, Luz. Any other questions or comments from the group?
Yes, this is Meg with the JCC.
Go ahead, Meg.
I was just wondering, so this coordinated training, is it exclusively a train the trainer model, or would your team be working directly with clients?
Yeah, I think we'll still be having like the START training that we did will probably fall under there. So we will still be able to come out and teach organizations of our travel training that way. It doesn't have to be just train the trainer courses.
Okay, thank you.
So the state, Access actually, has been trying to reduce the number of transportation providers amongst their mental health providers. Is this a precursor to consolidating client transportation?
No, I had no idea about that. I don't think so. It's definitely not where it came from. We were just looking at different ways to help coordinate all our trips and trainings and teaching people how to use our fixed route systems. And we're the city's transportation, so we're not really involved in a lot of the state things.
Did that help, Steve?
No, I'm pretty jaded. So
if it was in the back of somebody's mind, it was not shared with us, Steve, if that helps.
Any other questions for Luz or Davida on either the on-demand or the travel training?
This is Meg again. Who should we reach out to if this is something we want to learn more specifics about?
Yeah, you can reach out to me. I'll put my email in the chat so everybody has that.
Okay, great. Thanks.
All right. Thank you guys all so much for letting us share this with you all. We look forward to working with everyone. And I'll stop sharing my screen now.
Thank you, Luz. Thank you, Davida. I appreciate you investing time with the group today. I'm hopeful that many of you will reach out to Luz and ask more questions about the two different programs, if you will, the on-demand and of course the travel training. I think there's a great opportunity to partner in that and see how we can grow not only the travel training program throughout our region, but also making sure that people that you serve have some additional support and resources available to them. So I encourage you to just kind of reach out to them and see what makes sense for your individual organizational needs and your client needs. We're going to go ahead and move to the next item on the agenda, which is we're going to take a look at the agency profile data findings from that questionnaire that I had sent out, or survey, I guess you could refer to it as. So I think there was like 26, 27 questions. I know there's a few organizations that ran into some challenges in answering those questions. So they are still trying to get those answers to me. So we don't have 100% of the information back. So the findings could definitely change a little bit based on what I have right now in relationship to when we get those in. But I thought it would still be important to kind of go over a little bit what we're seeing thus far. And again, some of the elements could change a little bit. So just as a quick refresher for those that it might have been a little bit since they actually filled out the answers to those agency profile questions, and of course new folks that are joining us today, and anyone who's still in the mix of answering those questions for their own organization. So the questions were geared to help us get a better understanding of how the programs or services in the PAG region are serving people in our region with regard to the programs or services predominantly focused on folks with adults with a disability or predominantly elderly individuals. And according to the FTA, elderly is defined as 65 and over, or anyone considered ADA eligible in Pima County. Are we predominantly serving youth and children, which would be under the age of 18 with a disability? Or are we serving those that are considered both elderly, meaning 65 and above, according to the federal definition, and disabled? Like, where are we kind of landing as a group? And are there some populations, if you will, within the 5310 construct that are arguably underserved, right? That doesn't necessarily mean that they are, because there's lots of organizations that are serving in this capacity, but they're not necessarily applying for 5310 funding. So I want to make sure that that part's clear. But as far as our 5310 group as it sits right now, kind of where do we stand? And also be able to shed light on the great work that is happening in those particular areas. In the same spirit, we wanted to kind of get a good understanding of within that, where do these programs typically operate within? Are we predominantly serving in urbanized areas? Are we predominantly serving in rural areas? And then if we could kind of drill down a little bit further and say, but when we say programs or services, what does that look like? Or what does that represent when we say they're happening in rural or happening in urban? And so we kind of had this landscape of different types of programs and services, ranging from like job development or vocational training to day programs to behavioral health, different types of resources and support services, camps, after school programs, public transportation, and the list kind of went on from there. We also took a look at if any an organization's programs were perhaps limited by a geographic location, whether urban or rural, due to access to transportation. So we wanted to kind of get an understanding of is there an issue with regard to access to transportation, and is it having an adverse impact or a negative impact in terms of program growth, I guess is how we would phrase it. In the same spirit, we also want to take a look at trip percentages, right? So we have all these trips happening within the region provided by different 5310 organizations. But what's kind of the general makeup of those trips in the sense of how many of them are going to a particular type of trip purpose, if you will. So how many percentage wise, if you will, are intended to take people to, let's say, dialysis, what percentage are going to mental health appointments or grocery shopping, employment centers, recreational, social type of activities, job development, or any type of vocational training. And the list went on from there. And of course, we're also including things like education, going to university or school, or any other type of education location. Some of the other things that we looked at is if we were going to look at trip purposes, if we were going to isolate it to like a primary one, this is kind of our primary driver. This is where we do the bulk of our trips and break down percentages. If there was a second or a secondary trip purpose, where would those land in that same capacity? But then in the spirit of coordination, much like Davida and Luz were sharing within their programs that they're trying to develop or grow and support our region, and of course the 5310 agencies, where do we have kind of perhaps an opportunity to advance coordination around trips? And so it was important to understand that trip purpose, both primary and secondary, but it also is important to kind of get a sense of, but if we say dialysis, or if we say pharmacies, or if we say medical appointments, is there a common theme, or do they predominantly go to one particular location or facility? And is there kind of an intersection, if you will, no pun intended, meaning like we're all kind of landing not only to a pharmacy, but the very same pharmacy, perhaps even at the same cross street. So I'm trying to take a look at those pieces, because that would kind of give us a lens for some potential coordination of trips, or at least, if nothing else, a good place to start in unearthing and those types of opportunities and asking deeper questions. The other piece was just to try to get a better understanding of, talk about client-based transportation services. What are the populations that those fall into? And again, elderly being 65 and above, is it disabled adults, is it children? And then we wanted to say, if we are going to potentially, there's an opportunity for non-client riders to be able to trip, that is serving currently client-based riders. Where does each organization stand in saying, okay, we can't necessarily do it today, but there might be the potential to do this, and if so, it would fall into this category. And so there was a long list of potential options, ranging from elderly, just specifically by age, disabled, meaning with regard to developmental, but specifically youth being under the age of 18, all the way through to mental health related disabilities, veterans, physical disabilities, et cetera. And there's a long list of those for people to kind of say, here's where we might have an opportunity to engage non-client riders in terms of being able to coordinate trips. And so we wanted to take a look at that. Some other things that we looked at is kind of tying back to other programs or resources or support services that might be available, or could be made available rather, to 5310 agencies. And then that's where we started looking at, what types of trainings would be most value added to 5310 agencies. And that could be for driver training, it could be training for your clients, and it kind of tied back into the travel training. We asked some questions also about fleets, and really trying to understand the costs associated with maintaining a fleet, some fleet forecasting elements, of course, tying back to driver training, and the list goes on. And so on our agenda today, we wanted to kind of share at least a snapshot of what we're seeing so far as the answers have come in basically like 4 different areas. And so one of the areas was for the potential for non-client riders. And right now, the most common category for a potential non-rider to join landed in both those with a physical disability and or a mental health disability. And it kind of almost had like a 50-50 split. There was a lot of agencies that said it would definitely have to be adult only. And then we also had a pretty high percentage of people saying as long as they were under the age of 18. So as more information comes in based on those surveys, we'll be able to give some harder numbers on that percentage wise. But that's at least a good place to start. A third category, if you will, was also serving veterans. There was a lot of agencies that said they would be open to on non-client riders being veterans. So there's some good insights there for furthering a conversation. For the value added reports, that was one thing that we did ask in our agency profile questions. And so we asked for what type of reports would add the most value to your organization. And each organization was asked to kind of stack rank, if you will, the type of report they felt would be the most value added to them. So I think there was like 5 or 6 choices, but you were asked to pick kind of your top 3. And so in that, the top 3 fell into driver training. That was one of the key pieces that people asked for some value-added reports around. The most predominant one was with regard to fleet management costs, really understanding general maintenance, preventative maintenance, and of course, operational costs relative to their service hours. And then the other part was more in the space of fleet forecasting. So understanding replacement year, maintenance and repairs, depreciation, things of that nature. So those are the ones that we are looking at right now based on how the information has come in so far. But again, we're still waiting on a few, so we might see a shift. But right now, those are kind of the top 3. The other piece was heavy in the forecasting of funds. So as people prepare for future grant cycles, not only was there kind of a resounding voice about help us understand our costs associated with our fleet so that we can be prepared for when a grant cycle comes around. The other part was the fleet forecasting in terms of deciding when it makes sense to potentially apply for a new vehicle. So we're seeing that, which to some extent is not necessarily a big surprise, but the part that was a little bit surprising was one of the questions we asked was how many hours it would take an organization to run a report or calculate their transportation costs. And obviously we have organizations that are very large, and we also have organizations that are much smaller. But we did have several organizations that said that it would take them over 8 hours to kind of calculate those costs. So we do have an opportunity to see how we can make that easier for organizations. So it's still worth taking a look at. I think the lowest we ever had for most of the organizations was 3 to 5 hours. So based on the initial findings that we have right now, it appears that there might be an opportunity to see how we can make it easier for agencies to run those type of reports. But again, we'll take a closer look once all the findings are in. Safety and incident prevention was another thing that we wanted to look at. And so in doing that, in the survey or the preliminary survey, if you will, one of the things that we did try to ask questions around was with regard to driver training or passenger training. And so when we asked the questions, one of the questions we asked was with regard to COVID, and it was saying, what's been kind of your top 5 most significant changes to your day-to-day operations? And you were asked to stack rank them again, like 1 through 5. And I know for a lot of the organizations, driver training got impacted significantly for obvious reasons, social distancing, et cetera. So as we plan for future trainings now that hopefully we're starting to come out of the pandemic a little bit, we could start to make some more plans. And I know at the ASDA conference that's coming up, they're asking for feedback for different types of trainings that you would like to see and support around topics such as incident or accident prevention. So I think we have a great opportunity to see what we could do in that space, whether on our own accord or with some support from ASTA in the future conference. So those are some of the things that really jumped off the page, if you will, in our agency profile questions. Again, we're still waiting. I think it's 5 agencies. I think it might be down to 4 now. But I think 5 agencies are still trying to get their numbers in. So as soon as those numbers are in, we will run that, and then I'll kind of share with the group what the findings show, and I'll probably ask for your feedback on what element we would like to tackle first, and what the appropriate next steps would be for that. But on that note, just as a friendly reminder, I know it's not specifically in the agenda, but it is related to some of these pieces, so I don't feel completely remiss mentioning this. ASDA is looking for feedback from you in terms of what you would like to see at the ASDA conference. So if you have any topics that really are heavy on your heart and you would like to see those, please let me know so I could share that with ASTA. In the same breath, in the spirit of the driver training and passenger training and accident prevention and a myriad of other trainings that you as organizations do internal or even share with others, I know a lot of you have some really great best practices that would just be really great to show other organizations, not only within our region, but across the state at the ASTA conference. And when I was chatting with the folks at ASTA, they really welcomed the opportunity for any agency who would like to do a presentation and share kind of those best practices or what they're doing within their organization up at the ASTA conference. They're looking for volunteers that would like to do that. So if you have something that you're really proud of, you would like to share that information with other folks throughout the state, this would be a really great opportunity for you to do that. So if you're interested in that, or you'd like to learn more about what the ask is, what the time commitment would be, et cetera, we can talk offline about that, and I can get you the answers that you need. So any questions so far on whether it be the asked piece real quick, or some of the things that we're learning from the agency profile questions? Okay, I'm going to take that as we don't have any questions at the moment. So I guess that can be a good thing, or maybe just some folks are just really shy right now. So if you have questions, feel free to send them my way in email, or you can pick up the phone and call me. Either way is fine. For those of you that are still chipping away at those questions, I would really appreciate it if we get those in sooner than later, because I have some internal deadlines that I really need to meet, and it would be a great help to me to get those in so I can meet those deadlines. So, and if you need any help or you have questions about how to best answer those questions, feel free to call me or email me. I thought I heard someone.
Hey, Janine?
Go ahead, Nick.
Hey, I had a quick question. So I reached out to our data validation folks for some more detailed information for the questions you needed.
Sure.
Would you like me to just send the amended information over to you, or would you like me to recomplete the entire form and send the whole thing over?
I think you could just send me the amended.
All right, great.
Yeah.
Thank you.
Yeah, no problem. Thank you.
And
I
then
appreciate it.
Also,
and I know,
also, is there, I think Luz said she was going to put her contact information in the chat box.
yeah.
I'm having a hard time finding a chat box. Is there anyone that can offer me assistance on that?
I'll send it out to the group.
Sorry, it was loose. Yeah, I was trying to find the chat box myself and didn't find it. So I was just going to email the group.
That'd be
if
great.
That's okay, Janine.
Yeah,
Thank you.
that's fine. Or I could send it out. We can chat offline, Luz, and figure out what you'd like me to send out, and I could send it out to the group.
Okay, thank you.
Thank you.
And Nick, I know you're one of the folks that comes from a very large organization, so I know the uphill climb's a little different in gathering this data for us. So I appreciate.
Yeah, and also, for kind of trying to figure out the information for all three of the main entities there. I think in reality, I should have done 3 questionnaires. So I might do that and then just resend, and you can disregard the other one. But we'll just see what they can get me.
Okay, that works. Yeah, if you want to send them as 3 separate, that's fine. That actually help us be a little bit more targeted, I guess you could say, in terms of understanding the data.
La Frontera does adults and children. La Paloma does primarily children, and CBIS is also kind of a mixed bag. So
right,
I'll get you what I can.
Okay, I appreciate it. I know there's a lot of large organizations on here, and even though it's only 26 questions, there's a lot of subsets, and when you're talking about a lot of different programs, it's cumbersome quick. So that part's not lost on me. I know it was a big ask for a lot of the organizations, so I'm just still trying to meet my internal deadline. So I appreciate all the hard work that everyone put into it. So. All right, any other questions? We're about 4 minutes out from our proposed time for today's meeting, so I want to make sure that I stick within those guidelines and in respect for everyone's time today. If there was any other questions that came to mind that you want to quickly ask Luz or Davida, now would be a good time. Otherwise, like I said, I'll send out her contact information, and you can follow up accordingly using that. Anything else that's kind of top of mind anyone wanted to ask? All right, so we are going to go ahead and start to conclude today's meeting. The calendar for the mobility coordination meeting, the dates that are already in there, those should be the ones we're going to stick with. I thank you now for your flexibility and me changing and departing from the original date that we had for this particular meeting. But I'm going to try really hard to make sure that this is the exception of the rule, that we stick with the calendar, because that was kind of the point, so that everyone could kind of plan and know when the coordination meetings were going to be held. So we're going to try to make sure we honor that throughout the rest of this calendar year. So if this date, or I shouldn't say date, if this day of the week, being Tuesday, and this time frame, the 10 o'clock, still seems to work well for the majority of us, then we're going to stick with out of this time frame for when we start building the calendar for 2022. If anyone is starting to feel like this day of the week and time is causing them heartburn and we need to look at a different day and time, please share that with me, because I'd like to start building the calendar for 2022 so that I can get that out sooner than later, and so that you kind of already have that in advance, because it's hard to believe it's already August, and I know I'm going to blink twice and we'll be at the end of the year. So I want to go ahead and start tackling that. So it is 10:58, and I'm going to go ahead and conclude today's meeting. I thank you all for investing time today. I know your time is valuable, and so I appreciate all the work that you did on the agency profile questions for me. And I really hope that you'll reach out to Luz and her team to see how we can best partner together on some of the things that they're doing to support us. So I thank you for that, and have a great day. Thank you, everybody.
Thank you. Bye-bye.